Well, fatty liver disease is a condition that is very highly prevalent in the United States today. It is the liver expression of obesity. And as we know, obesity now has epidemic proportions in the U.S., perhaps including 30, and by some statistics 40% of the U.S. population has a body mass index that places the individual within the obese definition. Well, so fatty liver then is the impact on the liver of this problem, and it's characterized by finding a lot of fatty cells in the liver, which can cause inflammation, scarring tissue, and ultimately progress to cirrhosis, liver failure, or liver cancer. In many patients, it has been shown that weight loss arrests the progression of fatty liver. In some persons, actually assist with elimination of the fatty liver. But weight loss is not always easy to achieve. The problem with fatty liver disease is similar to hepatitis C, and that is that in the vast majority of persons doesn't give any symptoms until it is late. So these two conditions, fatty liver and hepatitis C, can progress over decades without giving any indication to the patient that there is something severe going on in their liver. By the time the patients develop jaundice or fluid retention, ankle swelling, bleeding, it is a very advanced stage of either the fatty liver disease or the hepatitis C. The fatty liver disease is primarily treated with weight loss. That is still the hallmark of the treatment. When the obesity is extremely severe and at a degree of obesity that we call morbid obesity, a consideration for bariatric surgery needs to be discussed with the patient, given that the recent research has shown that bariatric surgery appears to have quite a bit of a beneficial impact on the fatty liver disease. Most likely there are a number of obesity-related hormones that change after the bariatric surgery, and that is really the mechanism by which the inflammation of fatty liver disease decreases after bariatric surgery. We often use diabetes medications to treat insulin resistance in patients with fatty liver. Insulin resistance being, in a lay terms, a very early form of diabetes there. But the evidence supporting benefit in fatty liver of diabetes-related medications is not entirely clear. There are two other groups of medications that are under active development for fatty liver, one of them being in the class of medications that interdict or interfere with the accumulation of scarring tissue in the liver. And the other group of medications are those who try to improve the inflammation that is associated with fatty liver. Hopefully within a few years we will see medications reaching the clinical use for this condition.